We've been working with the unions, with HEABC, and the bottom line is everybody will be employed by the ministry at a specific rate so that they will not be penalized, and that they will all be at the same rate, and there will be a central assigning body that works essentially under my direction, under the order, to ensure that each facility has sufficient staff. So it is a complex thing. We have many different types of contracts and employees, and we need to make sure that it's done in a way that doesn't disadvantage anybody, and that it doesn't allow people to pick the place that pays a higher wage, for example. So this is an extraordinary time, and this is a very important measure. So for the time being, everybody will be at the same wage and will be offered full-time employment so that we can make sure we have the adequate staffing for every facility. As you can tell from saying that, this means a lot of different contracts and negotiations and things that have been worked on, and I just can't thank enough our unions and the HEABC and our team at the ministry who have been working day and night on this to make sure that we do the best that we can do for our healthcare workers who work in these facilities, and to be able to best protect our seniors and elders in the facilities. So it is something that will be rolled out over time, focusing, of course, on where the need is most, which is the Lower Mainland, and that's started already. The request for assistance is around, and I know the number of, I think it's up to 11 now, that we have facilities where we have outbreaks. That's a very challenging time because we make sure that we put restrictions on what staff can do, on what visitors can come in, on what residents can do, and it is an exhausting thing to be managing an outbreak and to be working in those facilities. So I know there has been requests for assistance from others to come in and supplement the staffing in some of those facilities, and I'm also very grateful for the number of nurses and care aides and others, healthcare workers in those facilities, for stepping up and helping out during this period. Right now, all of those contracts, we've essentially said, for the purpose of this pandemic, we're going to hire everybody, as many as we can, full-time by the province, to be assigned through a central body. So that is for the next 6 months. Whether there'll be a review at the end of that, I personally hope so.